Good afternoon, everyone. I am Selena Gore, the CEO of Women Heart, and it is my privilege to welcome you to this very special Women Heart Live event. The title is Breaking the Silence, Saving Lives, a Black Maternal Health Conversation. Today, as we honor Black Maternal Health Week, we bring vital awareness to a crisis affecting Black women across America. They are nearly 3 times more likely to experience pregnancy-related complications, and especially those complications that are linked to heart disease. I am so honored to be joined today by Women Heart champion and Black maternal health advocate and expert, Dr. Charity Watkins. Dr. Watkins is an assistant professor in the Department of Social Work at North Carolina Central University and at Duke University's Department of Obstetrics and Gynecology as a scholar in the Duke NCCU Building Interdisciplinary Research Careers in Women's Health program. That is a mouthful.
Yes, it is.
Charity's research, rooted deeply in her own personal experience with peripartum cardiomyopathy, examines how social work can address racial inequities in maternal heart health care and create critical support and networks for Black women. Dr. Watkins also serves as the board chair for Equity Before Birth, advocating for meaningful policy changes and community-based solutions. So, Dr. Watkins, Charity,
Yes.
my friend, welcome, and thank you for joining us today.
Thank you, Selena, so much for having me. And it's always a pleasure to see you, especially during Black Maternal Health Week.
Absolutely. So why don't we get right into it?
Sure.
Can you please start by sharing your personal journey with peripartum cardiomyopathy and how this has shaped your mission and your research and your purpose?
Sure. So, funny enough, it was almost to the day 9 years ago when I was diagnosed with peripartum cardiomyopathy after having weeks of symptoms that were very much like classic heart failure symptoms. I couldn't lay flat on a pillow. I had this nagging cough that wouldn't go away. I just couldn't even go up a flight of steps. And you're talking to someone who was walking 5 miles during my third trimester, but not being able to go up one flight of steps without having to take a break. And eventually it culminated into me experiencing this radiating pain in my left arm and jaw and into my chest. And that prompted me to go to the ER. However, I thought I would receive care there after talking to my OB and seeing her twice in order to get help with the symptoms. I waited 5.5 hours in the ER and still didn't get to see anyone and didn't get care. And it wasn't until I was examined by a physician for campus health because I was a doctoral student at that time. And he examined me, found that I had an enlarged heart, did a physical referral, which in other words was rolling me down to the same ER in a wheelchair, where I waited hours again, only to be admitted into the cardiac intensive care unit. And I stayed in the hospital for about 2 weeks. I had an issue with a medication, a beta blocker, which many folks with heart failure are very familiar with, and had to restart my medication regimen. And then at the age of 30, was finally diagnosed and treated for heart failure. And I was a new mom. I was a first-time mom. And so I had all these thoughts and dreams about having more than one child. All of those dreams were gone at that point. I also had shared my family history. My mom and dad both had heart failure, shared that information with my provider before I actually became pregnant. And none of that was really taken into account during my prenatal care or my postpartum care. And so just pointed to a lot of different areas where things could have been handled differently. And I thought a lot about that, especially as a doctoral student. Research is something that I love to do. And so after experiencing that and kind of developing my own process and journey of survivorship, I decided I needed to figure out how my survivorship can maybe help some others survive. And so I switched my research to focusing on health disparities.
Wow.
and being able to look at how my field of social work can improve maternal health outcomes for all, but specifically, especially for Black women because of our higher rates, not only in terms of maternal morbidity and mortality, but also in terms of cardiovascular disease. And so that is how I got here now, and serving as an advocate, serving on strategic advisory boards, really being an advocate around patient engagement, because I always say patients are the experts of their own stories, and those stories are data that are worthy of being studied. And, always wanting to ensure that communities are represented, especially communities that are directly impacted by these health outcomes.
Wow. I mean, that is just, can we just take a moment? I mean, that is so much that you've already been through. Charity, your work really highlights the significant racial inequities in maternal health care, particularly, as we've already talked about, focus on heart-related complications. What are some of the primary drivers to these disparities, and why do you believe that the voices of Black women have historically gone unheard or certainly underrepresented in maternal and heart health care?
Well, I will quote Malcolm X when he said that Black women are the least protected group in the United States, and I know that there's a lot of folks who do not feel protected in different ways, but what it really highlighted was for health outcomes. Black women have been told over and over again that they have experienced pain in a different way and actually can withstand pain at a higher rate than maybe other groups. We have been the focus of experimentation when it came to the development of reproductive health and gynecological health. We have not always been seen as valuable or needing care and concern maybe as other groups. And so what we have seen as primary drivers of these disparate outcomes have been primarily racism. And racism has been identified as a social driver of health, but more in terms of kind of a separate entity, but it really does drive, for instance, what kind of healthcare you have access to. It drives what kind of implicit bias you may experience in the actual patient room. It drives, what kinds of stressors you experience on the day-to-day. I know for myself as a Black woman, I can't hide that. I go out into the world and I'm a Black woman immediately, nor do I want to hide it, but it's going to shape how I enter spaces and how I'm perceived. And being perceived, for instance, as an angry Black woman, or being perceived as a difficult patient, or someone who's combative or non-compliant, all of those things can have very, very serious outcomes for patients, and it has over time.
Wow. I mean, again, just it's really incredible to think about all of the history sort of that feeds into where we are today. How specifically can social work, your field of expertise, in the intervention sort of developed within the context of social work, disrupt these systemic inequities and improve outcomes for Black mothers experiencing heart-related complications?
Yeah, so if we think about cardiovascular disease, especially among women, many times we're thinking about what may be genetically going on, but that's not what we need to focus on. We need to focus on what kind of stressors women are experiencing at higher rates than men. So if we think about the fact that women are oftentimes the caregivers in families, not just for children, but also for parents, for instance, always the ones that are dependent upon. Really, the Black woman schema really talks about this, and the superwoman schema of having to care for everyone, which is exhausting. It tires you out. It literally leads you to the point of having to sacrifice your own well-being to care for others. And so what social workers can do, and many times we're seen as the mental health experts. And yes, that is true. We serve an important role in mental health. However, we also are trained and have skills around being able to facilitate patient-provider interactions. We are trained from the very start in our bachelor's programs, and I can speak to this because I also teach. We are trained as bachelor's and master's level social workers on how to manage conflict, how to identify and address implicit bias, how to identify structural racism within the systems that we operate. We have training in all of these areas at all of these different levels that really can be tapped into if, first, given the opportunity to have our roles defined by us as social workers, but also being given the professional respect that comes along with that. So being hired at higher rates, so we're not, relying on one social worker to serve multiple units, but really having teams of social workers who can address these needs at different levels, and also paying us. We love pay, and we love to be
Absolutely.
paid in a way that aligns with the work that we do, the critical work. And when we're talking about these maternal mortality rates, we have to think about how cardiovascular disease is appearing and contributing to those numbers. Yeah. Cardiovascular disease is the #1 killer for Black women, Black mothers, and these deaths are most often happening postpartum, so after that 6-week mark. Social workers are in communities, social workers are in hospitals, we are everywhere. We just need to be tapped in and brought to the table when these issues are first appearing or even before they occur.
Charity, I often say that we are getting good attention around the maternal mortality crisis. Mm-hmm. But what is very rarely talked about is that the next line should be, and this crisis is about cardiovascular disease. Yes. And we don't really talk about that part of it. Can you talk more about, you just mentioned that social workers are in the community. Can you talk more about the critical role of community support networks and how they contribute to improving maternal health outcomes?
Sure. So I think, and one thing I like to practice is professional honesty, which means that we have to acknowledge where our field is and where it needs to go, areas for growth, areas for improvement, but also we can, celebrate our successes. One area of growth that we really need to focus on is how social workers can work alongside healthcare providers and be able to serve on these interdisciplinary teams that will allow for them to be able to help with identifying those cardiac conditions and being able to help patients understand what those symptoms are and how their life is going to continue after this, not end, but continue, maybe in a different path, but life happens after these cardiovascular conditions. In terms of maternal morbidity, we oftentimes are trying to identify what happened for someone to lose their life, but less attention is placed on those who do survive, and now life is completely different. So social workers can provide that mental health support, and I should also note that mental health conditions is the #1 cause of maternal deaths for all women across the board. Wow. And we're talking about suicide, we're talking about substance use disorders, overdose. Social workers are literally trained in addressing all of those needs. And in the community, what we need to think about is the fact that many folks do not trust these very formal systems. Formal systems have clouded backgrounds, which is going back to that professional honesty. We have to recognize how we may have contributed harm to communities and how that may shape how they view us now. And so we have to take ownership of that. We have to acknowledge it. We have to learn from it and learn from communities themselves. First, what your needs are. How can we overcome these barriers? How can we improve our trustworthiness? Because trust is one thing, trustworthiness is something else. And how can we learn from you? Because oftentimes community-based organizations are already doing the important work. They have already figured out from their own folks what needs to happen. And they have already developed interventions and initiatives that will answer those questions. But we need to team up with them, let them lead, and learn from them so that we can figure out how to replicate those kinds of programs, initiatives in other communities. So we have a lot to learn from communities. We need to learn how to first become trustworthy. We need to learn what works for communities. How can we ensure that community-based or community-driven programming is specifically focused on the needs of those communities? And we need to acknowledge the contributions of community members and organizations. We can't just take their work and go on because we have bigger systems and greater access to grants and all of those things and then just, fly off. But we need to make sure we're building up the communities that are already doing the work, already have the great, brilliant ideas, and can figure out ways to bring those ideas to other communities as well.
I really love that. I love this concept. And I also, when I have been in the hospital, I have had the experience of having a social worker come to see me. And I always find that it's pretty disjointed. In other words, I in the back of my mind, I ask the question, why are they here to see me? Right. And so I think that the next question I'll ask is a little bit connected to that experience is how can medical professionals, social workers, and advocates collaborate more effectively to bring about changes, and in particular for the people who are experiencing the support of social workers who may not actually really understand why they're in the room in the first place.
Yeah. I mean, well, you're highlighting, Selena, an area that I get very frustrated about. Many folks do not know what social work is.
Yeah.
We're oftentimes kind of grouped together as just child welfare, and we're, baby snatchers, very negative connotations related to our field. When we do so much more, we don't actually want people's children. We want people to stay together. We want families to stay together. That's actually our goal. However, we also work in other areas. I call social workers the folks who connect the dots. Yes. So we are the ones who are able to pull resources from communities, also develop connections and collaborations with institutions. And then we're bringing all of these folks together and saying, hey, we all need to come together to come up with some solutions. So I think there needs to be some professional humility at times, the sharing of power across different disciplines, so that we can see it's not about who has the right of control, but really who's able to come together in a collaborative nature in order to come up with solutions for this specific group. Like that needs to be the goal. Not trying to, I guess, figure out who has what role and then who has the power along with that role. Yeah, that seems to be a big issue that I'm seeing a lot, very often actually, within these very big hierarchical systems.
Right. And to your point, like every professional in that brings their unique expertise that need to come together in a collaborative fashion. Right. I think that's where we want to go. So, thinking about our audience and folks in our audience who might be like wanting to take action.
Yeah.
What might you suggest as immediate actions that somebody in our audience can take to help elevate and amplify Black women's voices in maternal health, maternal heart health in particular?
So you do not require a PhD in order to advocate for Black women. This is something that can happen just as you are walking outside your door, going to the grocery store, just in day-to-day activities. If you see a Black woman asking for help in a store and you see that she's ignored, maybe going and using, if you are a different identity, using your identity in order to call someone in and say, hey, this woman actually asked for help. Can you help her? That's something that anyone can do. When it comes to healthcare, I know my neighbor, I love her so much. I had to go to the hospital within the last year, and she did one of the most amazing things for me. She said, I'm going to be there with you because I recognize that I'm a white woman and they may listen to me more. Amazing. And so I'm going to go to the ER with you. I'm going to speak up for you. I'm going to be there to ensure that they are explaining things to you because you're not necessarily in the best state in order to hear it. So I'm going to be your second ear. I'm going to be there to be your voice when you're not able to speak up. My neighbor did that for me. We are able to do this. It does not require you to have a certain level of education, a certain status. It just requires you to see someone else as a human.
To show up, right? To show up.
Exactly.
Are there specific resources out there, Charity, that you would recommend for those wanting to learn more, wanting to get involved, and maybe wanting to do some advocacy work so that they can, like your neighbor did, lend their voice, lend their status, lend their privilege to this issue?
So there are so many amazing community-based organizations that are doing this work. They are on LinkedIn, they are on Twitter, they are on Instagram, they are everywhere. There are conferences that are being held, such as the Black Maternal Health Conference that just passed last month. There are organizations such as Equity Before Birth that I have the privilege of serving as the board chair for. But these kinds of organizations are all over, and they're looking for volunteers. They're looking for folks who can use their expertise or their skill set in order to uplift the work. So I think honestly, just searching Black maternal health in your area will allow for you to find organizations in your area that you can support and advocacy opportunities as well.
Awesome. Awesome. I'm going to ask you one last question about the future.
Yeah.
It's a tough time, as we've just talked about, but what gives you hope, Charity, about the future of Black maternal health, and what keeps you inspired to continue on in your advocacy?
So this week I had the honor of attending and participating in Black Maternal Health Day of Action at the North Carolina State Legislature. And we arrived there, and when I walked into the room, I walked into a room full of Black women. Black women of all different shades, ages, different groups representing organizations that I'm a part of, other organizations. I also saw white women. I also saw men. I saw people all over who were standing for these issues. That gave me hope, because that signals to me, and this is my 3rd year participating in it, every single year it's gotten bigger.
Oh, wonderful.
That shows me that more people are paying attention to this issue, and not only paying attention, but also wanting to figure out how they can contribute in positive ways to change. And so every single year that I go there, that my state senator, Natalie Murdoch, brings us all together, and it gets bigger and bigger and bigger each and every time, that's hope for me.
Amazing. Amazing. I've learned so much. I'm as usual, every single time I speak with you, Charity, I'm inspired to do more in this space. I want to thank you for sharing your powerful story, your insights, your expertise, and just your energy with us today. Your advocacy and your dedication are so inspiring and critical to this ongoing fight to save lives of Black mothers, whether it's in North Carolina or anywhere around the country. I want to also just say, I've known Charity for a long time now, and she brings this message to lots of spaces. She does so much work in the patient safety space. So she thinks about this in a 360 kind of way, where she's making, as she just talked about, connecting dots in ways that you might not even expect or might not even realize the interconnectedness of. So I would also urge you to follow Dr. Charity Watkins. She's incredible, and you will learn so much more than you learned today. To everyone joining us, remember that breaking the silence around Black maternal health isn't just a conversation, and it's not just a one-time deal. It is a call to action that you can carry on well into the future. So let's please continue to educate ourselves, those around us in our spheres of influence, advocating for change, lifting up voices and experiences of Black women everywhere. And I share the optimism and the hope that Charity has, that together we can really make a difference. So please be sure to follow Women Heart on social media for more important conversations like this. You will find resources and more information about this at our website, womenheart.org. And I really thank you for joining us today. Thank you, Charity, as usual.
Thank you.
Such a wonderful and important conversation, and we look forward to having even more in the future.
Yes, thank you. Thank you, Selena.